So I was born and raised in Baton Rouge, loved it here. I went away for college, went to Vanderbilt for undergraduate. I actually started out in engineering there, and it was a terrible fit for me. Ended up majoring in something called medicine, health, and society, which is kind of all the not science part of medicine, and loved it. So thought I wanted to kind of go a medical route. Ended up doing a master's at Tulane in New Orleans in pharmacology, and then was accepted into LSU Shreveport, where I did medical school. So then I did 3 years of pediatrics at Eastern Virginia Medical School in Norfolk, Virginia. Stayed there for an extra year as a chief resident, and then came here to start my first real pediatrics job full-time, and have loved it so far. I've loved being back. It was time. It was really good time to move back. I met my husband, Brian, when we were in medical school. So he is also a physician in emergency medicine. So that's been fun to kind of keep up with both sides of it. And we have a son right now, John Patrick. So it was great to be closer to family and, you know, to raise him somewhere that I grew up and loved. It's been a lot of fun. Did not know going in, liked a little bit of everything. Pediatrics was actually my last rotation as a third-year medical student when we were kind of going through all the different clinical rotations, and I liked some of it. I knew I wanted to do primary care. I liked the relationship with patients and families and kind of getting to know people. And then once I did the pediatric rotation, it was like a light bulb went off, and I was like, oh wait, this is it. So I love all the range of pediatrics, from the little babies to the teenagers. I really like the preventive aspect of a lot of pediatrics, the idea that if we can kind of form healthy habits earlier and at a younger age, you know, trying to prevent some of those longer term health issues if possible. Well, one part of our job that I don't know if everyone always realizes is a lot of times we go and see the newborns in the hospital. And so it's always a really fun way to start your day, is to get to go to see the babies that were just born the day before or overnight, and see them, you know, right from the beginning, and get to be there with those families as before they even get home with their new one. So oftentimes we'll start there. I like having a mixture of kind of things throughout the day. Checkups, sick visits, I think is kind of where the ideal balance lies, so you're not getting one, you know, too much over the other. Every pediatrician and every person's gonna have a little bit different personality. And so I think finding a good fit for your family, someone that you can really communicate with, is gonna be key for that. There's a lot of things, especially for first-time parents, that you're like, is this normal? Is this not normal? Should I be worried? Should I not be worried? And so being able to bring that up and feeling comfortable bringing up your concerns to the doctor, I feel like is really important, whether you think it's important or not, or, you know, to bring it up and be able to talk about that. You know, I think here at the Baton Rouge Clinic, you're always gonna find a good person. We all really try to practice evidence-based medicine, follow AAP guidelines. So I think from that standpoint, you know, it's at some level, everyone's gonna be doing at least the same thing as far as treatment. So it's more finding that person-to-person fit that's gonna be what really makes the relationship special.